In this video, you'll learn some tips and strategies on how to alleviate the chronic cough that you've been suffering from. And in many cases, people have been suffering with chronic coughs for years. So keep watching for the information. How to stop coughing. Have you ever asked yourself the question, what is the cause of my cough and how can I stop coughing? First, you must rule out any serious medical reasons for your chronic cough, such as a smoker's cough, lung disease, pneumonia, bronchitis, emphysema, and acid reflux, which can cause an irritation in the esophagus, causing you to cough. Check with your doctor and pharmacist because there are some medications that can have an adverse reaction causing you to cough. To get rid of your cough, you've been prescribed cough syrup with and without coating, cough drops, steroids, nasal sprays, allergy shots, and inhalers, to name a few. When all else fails, you might even been prescribed antibiotics. When none of these worked, you might hear those terrible words, you just have to live with it. What? You mean there's nothing to help me get rid of this chronic cough? I know, you really don't want to live with your chronic cough. Well, there is hope. Hi, I'm Dr. Stephen Goldstein. I'm a chiropractor in Lynbrook, New York, and I've been treating patients with chiropractic, nutrition response testing, and advanced allergy therapeutics, depending upon what their problem is and what they're suffering from. If you'd like to find out about more tips and strategies on how you can become healthy, then please subscribe and like so you can see more of our videos. In my office, we use a technique called Advanced Allergy Therapeutics, also known as AAT. I know you went for medical allergy tests. You might have even tried allergy shots. You may ask, what makes your treatment different? Medically, they can test for about 200 different allergens. With AAT, or Advanced Allergy Therapeutics, we can test for over 65,000 different allergens and sensitivities. Since the 1990s, we have lived in a more toxic environment. Air pollution, water pollution, toxic ingredients in our foods. Just read the labels on the food you buy in the supermarket. Any of these things weaken the immune system, stressing your body, which can lead to developing an allergy such as a chronic cough. More than 100 million Americans suffer from allergies. The most common things you encounter in the environment that can cause a chronic or seasonal cough are family pets, such as dogs and cats, dust mites, pollen, fungus, trees, weeds, molds, and mildew, just to name a few. Do you know you can even develop a sensitivity to your own mucus? We call this category biosubstances, meaning you can have a reaction to your own body fluids. AAT does not rely on medication, herbal remedies, avoidance, injections, or supplements. AAT is non-invasive and totally painless. It is available to people of all ages, even infants. Everyone can benefit from this all-natural therapeutic approach to finding out what is causing your chronic cough and eliminating it. There's another technique we use in the office called nutrition response testing, or NRT. As I said previously, we're being exposed to a toxic overload from the environment and the foods we eat. Sometimes a chronic cough can be caused by various stressors that are hidden in our body. We'll be checking your body for food sensitivities, chemicals, heavy metals that become stuck in your tissues. We also test for other challenges such as bacteria, viruses, fungus, and parasites. We can determine where these stresses are in your body and what organs are being affected by them. We then design a course of action utilizing very specific nutritional supplements and herbs designed to strengthen your organs so that your body can have the ability to heal naturally. The more toxic a person is, the more I need to rely on a variety of treatments to alleviate the problem that the patient has. For us to find out what is causing your chronic cough, we may need to evaluate you with AAT and or NRT. More times than not, we'll only need to utilize just one of these techniques, and sometimes you'll have to use both. That all depends on how toxic your body is, how long you've been suffering, and what you've been exposed to. You heard the phrase, physician, heal thyself. I recently developed a chronic cough. There were times I couldn't even speak more than 3 or 4 words without coughing. Treating with AAT helped, but didn't totally get rid of my cough. Using NRT, we found that, believe it or not, we found that I had parasites in my lung tissue. Using specific nutritionals, my cough is starting to subside. Keep in mind, we're not treating the symptoms of a chronic cough. We're searching for the cause. What is causing the chronic cough? And once we find the cause, we strengthen your body so that it can start the healing process, so you can stop suffering from your chronic cough.